my name is Adam, and I'm the Fertility Advisor here at Verdua Healthcare Consultancy based in Malaysia. And I would like to welcome all of you to my channel. So last week, you've heard me answering some of the most important questions about premature ovarian failure. So this week, I would like to do something different with you. So this time, I would like to share with you a very inspiring story about an infertile couple. So first of all, let me get things a little bit clear here. So that because there are a lot of people who are confused about the terms infertility, subfertility, secondary infertility, and sterility. So because I would like to get all of these cleared with you so that you are not confused of whom you are. So you see, there are only around 2 to 4% of the people in the world that are truly infertile. But what does infertility actually mean? Infertility simply means that those people, they can't produce on their own. Alright, so you see, those people, they need to rely on assisted reproductive treatments like IVF, ICSI and all that. But you see, they can reproduce, but it's just not possible for them to do that on their own. Maybe there are ladies who has got blocked fallopian tubes or such similar problems that needs a little bit of help. But whereas you see subfertility, if let's say the couple is defined as subfertile, it simply means that their body's condition is not as perfect as they should be in order to reproduce naturally at that particular time. But they will be able to produce, naturally on their own. And sometimes all they need is just a little bit of a lifestyle modification or nutritional advice. And with that in place, they'll be able to conceive successfully. But you see, sterility is a little bit different. People who are sterile, that means that they are not able to reproduce at all. It could be due to a genetic defect, or it could be a surgery, or just a disease that made them stop producing sperm, or killing all the eggs, I should say. However, what's secondary infertility? It seems a little bit confusing. So for people who have secondary infertility, it means that they have given birth to at least one child before, but now they are having difficulty producing the second child or the third child. So I hope you got the hang of these terminologies and you can categorize yourself according to my definition just now. And so now I would like to tell you a story about my client. Let me call her Miss Chen, and she visited us around a year ago. So when Miss Chen came to see us, she was only 28 years old, and according to our customer database, that is considered very young. Normally our customers, they would be around 35, 40 years old, somewhere around there, and she's one of the youngest one we have ever seen. But anyway, Miss Chen was married at a very young age, I should say. So that's what she told us. And then she had been through many pain, just wanting to have a child. Okay, and then she told us that 2 years into her marriage, she didn't tell us which age did she got married, but anyway, 2 years into her marriage, she fell pregnant. And then during the time, she was very happy. Her husband was very happy, although the economic condition wasn't so good, but they are able to afford education for their child. So, but very unfortunately, during the regular ultrasound scan, the doctors just couldn't find where her baby is. In the uterus, it's just empty. But where is that baby? So the doctor was, in shock as well. And so after the second ultrasound scan, the most horrible nightmare actually happened to Miss Chang. The embryo was implanted in the fallopian tube. And I'm not sure whether you know the exact terminology for this. It's called an ectopic pregnancy. Now you see, normally the baby is supposed to be implanted in the uterus wall, and so that's what it is for, and not inside the fallopian tube. Okay, so that's called ectopic pregnancy. And if the baby continues to develop in the fallopian tube, it's going to burst, okay, and then it's going to be a very life-threatening condition. So what did the doctor do to Miss Chang? So they had no choice but to offer Miss Chang a surgery to cut off that fallopian tube. So that's the only solution at the time. And what does that mean for Miss Chang? It means that in the future, her fertility has been cut in half. And can you imagine how shocked and how devastated was she during the time? And so she didn't give up in having a baby. So it was really a trauma. You see, a loss of one fallopian tube and the loss of the baby. Often miscarriage is already did such a big impact to couples. And needless to say, that fallopian tube's been cut off. So she tried and tried again, but after a year of no news, then she came to see us. All right. So the first investigation that we did with them was to ask Mr. Chang to do a sperm test. All right. So after he did a sperm test, we were shocked as well. But it's understandable because of the working pressure that he got, both in terms of quantity and the quality of the sperm were just absolutely horrible. And even worse, the doctor didn't even check whether the other fallopian tube from Miss Chang was, blocked or not. And then we asked her, so we asked Miss Chang to do a test called the HSG. So this test, how is it performed? So the doctor will insert a very special dye into the uterus, and so hoping to see the dye flowing through the fallopian tube, so it indicates that the fallopian tube is clear. Okay. But because of the busy lifestyle, Miss Chang just simply couldn't arrange for that. And so we asked her, we asked her very clearly, we've instructed her not to get a baby, not to fall pregnant, before knowing whether the other fallopian tube is clear. All right? But you see, 5 months into the course, I should say it's an accident. She accidentally fell pregnant, and the worst nightmare had happened. The other fallopian tube, as it turned out to be, blocked. Another ectopic pregnancy happened to Miss Chang. She was absolutely devastated. She was at a point of a near collapse. There was no word to describe how sad is she. So, the doctor had no choice. Once again, they had to cut off the only and the remaining fallopian tube. And so, what does that mean? What does that mean for Miss Chang? It simply means that in the future, she had no more chance of getting pregnant naturally. And then, but very fortunately nowadays, there are many assisted reproductive treatments like IVF, ICSI that can help these couples. I mean, they are as good as gospel to them. And so Miss Chang, they continue to to be treated with us, okay? And 9 months into the treatment, we asked Miss Chang and her husband to, do a hormone test and do another sperm test. They were up to standard, and so we asked them, go ahead and try for another IVF cycle. Go ahead and try for their first IVF cycle and see how it goes. And so we referred them to one of our long-established panel clinic, and with the latest pre-implementation genetic diagnosis, or also known as the PGD technology, as well as using ICSI, meaning the direct injection of sperm into the egg cell, all right, that increased the chance of success. And so after a month of all these hard work, the doctor told them that all the embryos, in fact 11 of them, 9 of them made it through the PGD process, and they were grade A embryos. So because of that genetic diagnosis, Miss Chang knew that she had 8 baby girls and 1 baby boy. All right, and the doctor only had to implant 1 into her uterus, and she gave birth not just to a healthy baby girl, but a baby girl with absolutely no genetic defects. Okay, and that was their first hard-earned baby after 4 years into marriage. And she told us that she will have the baby boy sometime around next year. But she still got 7 more to go. Of course, that would depend on their economic condition and the decision. But anyway, friends, what's the most important message that we got from this story? It's that sometimes things can be really devastating and they will make you feel hopeless in your fertility journey. But very fortunately, nowadays, I have to emphasize once again that there are many levels of help that we can get. From a very simple lifestyle modification, maybe plus a little bit of nutritional consultation, to as complicated a treatment as PGD or ICSI can go. But one thing is for certain, no matter which treatment you end up with, and of course I hope you end up you end up having no treatment at all and you can get pregnant naturally, but just in case you do, you still can't escape from the responsibility of building up your body to be prepared for the treatment. Alright, so friends, I hope this story helped you and I hope it inspired you. And this concludes our case sharing session for today. Please stay tuned for next week's question and answer. Don't forget to click the like button to support us and subscribe to our channel for the latest fertility